Today, we will discuss the basic concept of pharmacology. Before knowing this subject, we all need to know the origin of the word pharmacology. Pharmacology derived from two Greek words. One is pharmakon and another one is logos. Pharmakon means drug and logos means to study. So the definition of pharmacology is this is the branch of science which deals with the study of drug action. Okay, then what is drug? Drug is any substance or molecule which is used or is intended to be used to explore, modify to physiological state or pathological system for the benefit of the recipient. This is the definition of drug. In simple way, we can say drug means API, means active pharmaceutical ingredient. As an example, suppose we are suffering from fever. In this time, we will need to an antipyretic drug such as Calpol, paracetamol. The API means active pharmaceutical ingredient. This is the substance which gives us pharmacological action. For this, the fever will recover from our body. Then, what is medicine? Medicine means the formulation of API, means the tablet of paracetamol, syrup of paracetamol. This is the difference between medicine and drug. Then we all need to know some scientist name because this is very important for our exam. The first one is father of modern pharmacology, Oswald Smithberg. Then father of Indian pharmacology, Sir Ramnath Chopra. Then first pharmacist, Galen Shah. Fourth, father of Indian pharmacy education, Mahadev Lal Shroff, sir. Then first Indian pharmacist, C.K. Kokate, sir. Then father of chemotherapy, Paul Ehrlich. And Paul Ehrlich, sir, also give us magic bullet concept. This is also very important. Father of medicine, Hippocrates. Discovery of penicillin, Alexander Fleming, we all know that. Discovery of streptomycin, Selman Waxman. Discovery of insulin, Benting and Best. This is some important words for our pharmacology. Then there is also an important word. What is xenobiotic? Xenobiotic, first of all, xenobiotic is not any antibiotic. Xenobiotic, it is an exogenous substance which is taken from our outside into the body. Means food, drug, medicine, they are the example of xenobiotic. Then we will learn the branches of pharmacology. The first one is pharmacokinetics, then pharmacodynamic, pharmacotherapeutic, toxology, chemotherapy, and clinical pharmacology. We will discuss here firstly pharmacodynamic. Here is a trick to remember. Here we firstly discuss what is pharmacodynamic. In this word pharmacodynamic, we can see D. And the definition of pharmacodynamic starts from D. So the definition is what drug does to the body is called pharmacodynamic. And the opposite of it is called pharmacokinetic. Means what body does to the drug, which include absorption, distribution, metabolism, and excretion. This is the definition of pharmacokinetic and pharmacodynamic. Pharmacokinetic means what body does to the drug, which include absorption, distribution, metabolism, and excretion. And what is pharmacodynamic? Pharmacodynamic means what D for dynamic. So what drug does to the body. This is called pharmacodynamic. Then, what is pharmacotherapeutic? It is art and science of treatment of disease. It's called pharmacotherapeutic. And what is toxicology? The science of the study of ADR or toxicity of any drug. Chemotherapy, treatment of infectious disease. And clinical pharmacology is scientific study of drug in our human body. Is called clinical pharmacology. This is the basic concept of pharmacology. In our next video, we will continue it. There is some also important topic. What is orphan drug? What is essential drug? What is prescriptional drug? What is non-prescriptional drug? So thank you for watching this video.